Hyperbaric oxygen therapy is essentially breathing oxygen at greater than normal atmospheric pressures. The oxygen is a catalyst of healing for your body. Your body now knows where to send new collagen and all the building blocks it needs to repair cells and repair damage. One of the things it does in the brain is help create new capillaries. So it starts building capillaries around the injured area. So we're getting new blood flow to that injured area of the brain. The other thing it does is helps reduce swelling. So when we have a traumatic brain injury, a stroke, any kind of damage to the brain, there's swelling that goes on. And between the new capillary growth and the reduction in swelling, you're able to get a much more complete healing.
I've seen some very favorable results with multiple different diagnoses. The vast majority of what we treat are neurotrauma, which includes mild traumatic brain injuries, blast injuries, and post-traumatic stress disorder. And I've seen some amazing results with those folks, both civilian and the military population, seeing improvements in headaches, sleeping, mood, cognitive functions, including speed of processing, sustained attention, and their ability to be more engaging in their personal lives and their community and things like that.
Hyperbaric oxygen therapy is definitely a treatment you want to do with other therapies. It's not the end all. The psychological counseling definitely has to be in there. Pain management may occur. A lot of times our soldiers are not only affected by traumatic brain injury, a lot of them have injuries from the blast that they sustained. And that needs to be managed as well.
One side, a bad side of it is that it's time consuming. You have to come in every day for a treatment, 40 consecutive days as frequently as possible. We're up and running 6 days a week. It's expensive, and I think that it hasn't been well recognized. It's not taught in medical school. It's not recognized by physicians. It's considered experimental, alternative, never proven. I believe that there were some original studies done, particularly on traumatic brain injury, that weren't very well done studies, and they sort of discouraged people from pursuing it for a long period of time. However, since then, there's been very good studies that have been done that have demonstrated the kind of improvements that I'm seeing.
There have been a lot of studies done at higher pressure for brain injury, which have been very ineffective. And I think when you compare that to the current studies going on at lower pressures, the findings that you'll see is that the lower pressures work a lot better.
I certainly feel that drugs have a place in the treatment of TBI. As much as possible, you would like to try not only alternative, but better treatments that have better outcomes. Sometimes the medications have just a Band-Aid effect. Sometimes they have a significant benefit that is good for the patient. What I don't like, and I often see, is sort of a mass-produced cocktail approach to giving individuals 4 or 5 medications just routinely, rather than doing one medication at a time, determining what the benefit is, what the correct dose is in a given individual. It's kind of a rapid, easy fix approach just to put somebody on these cocktail of medications. So I don't agree with that approach.
The American Legion has been great here in Colorado. They have really supported us in raising funds for the treatments, raising awareness, helping us bring in new veterans to be treated through the program.
Well, I don't believe that we should just promote the status quo forever. New methods of medical treatment for our vets need to be explored on a daily basis. All right? And I believe that this particular treatment has some worth. With ongoing success stories, we can get perhaps the Department of Veterans Affairs to take a little bit closer look at this.
We actually talked to a couple of veterans that were in there, and they were in there for the same treatment. So maybe that's something the VA really needs to look into and get on board, because it'll probably help a lot of our veterans, and that's what we need.
Our Humvee got hit by an IED, and I was thrown from the vehicle and knocked unconscious. Suffered a traumatic brain injury. Many more after that. Been shot at several times, hit a couple times. I would say the symptoms probably started within about 6 months. I didn't actually seek treatment for probably a year and a half. I tried to tough it out, tell myself to, be tough, quit complaining, things will be okay, you're exaggerating. And I finally got to a point where I knew I needed to ask for help. I went to the VA in '03 finally for help. Big one is anger outbursts. I'm easily confused. Several flashbacks. When the flashbacks happen, I'm no longer here. I am in uniform and I am in Iraq. It's all encompassing. I can't control them or predict when one's going to happen, they just do. Anger's a big one. Anger seems to just about invade everything I do. I get frustrated a lot quicker than I used to. Before I came here, I was getting talk therapy, and that was about it, really. I've been diagnosed or given several different drugs, but I don't want them, which is another reason why this was such a huge thing for me. It's non-invasive, I'm not going to be addicted to it, and what's better for you than pure oxygen? The first thing I noticed right away, my eye used to droop. They say it's one of the ways you can tell someone's had a TBI. As you can see, it's not anymore, and that was immediate, my wife said. As soon as I came out, she saw that, hey, your eye's fixed. Massive headaches daily for the last several years, and my pain level's gone from a 10 to a 2. The tinnitus ringing in my ears gone from a 10 to a 2. My life is manageable now, and I was gonna lose my mind. The pain and the constant ringing in my ears was so severe I couldn't concentrate. I couldn't do the things I wanted to do because I would get distracted by the pain and the ringing in my ears. I would forget what I was doing. And the worst part, I wasn't getting any relief. I tried aspirin, I tried drinking too much. None of that stuff helped at all until I did this. And I felt the effects immediately, the first day. I'm very optimistic about how my future's gonna be. I feel like I've got a big piece of who I used to be back. And that's all I wanted, was to get me back, to be comfortable in my own skin again. And I'm optimistic that that's gonna happen now. Before, I wasn't.
Currently, these treatments aren't covered under Medicare. So CMS, or Centers for Medicare Services, do not recognize hyperbaric oxygen therapy for brain injury as a treatable condition. There are many studies going on right now, including a study being done by the Army, to show the efficacy of hyperbaric oxygen therapy. But until that actually comes to where Medicare, Medicaid services will pay for these treatments, veterans are forced to pay for these on their own. We have the Healing Our Heroes program, which is centered around veterans, specifically those veterans coming back from Iraq and Afghanistan who have suffered from a brain injury that's service-related, or PTSD, which is service-related. We fund the treatments, which are then done at the Rocky Mountain Hyperbaric Institute. The program itself pays for housing for veterans who are coming to Louisville. The treatments themselves happen once a day, Monday through Friday, at least once a day. And for veterans coming from out of town, we also have housing available 2 blocks from the clinic. It's fully furnished. We provide food as well, so that they have kind of the comforts of home while they're here. If they do come from out of the area, we do 2 treatments a day, Monday through Friday, 1 on Saturday, just to get them back home sooner. There's no advantage to doing more than 1 treatment a day, but we know that being away from their support system is kind of hard on them. So we want to minimize that as much as possible. While they're here, we also do counseling for PTSD. We have a group called Combat Vets Helping Combat Vets. All the counselors have combat experience, so they understand and know what each of these veterans has gone through, and they're able to relate a little bit better than a civilian counselor would be able to.
These guys have made it financially as easy on me as possible. I haven't paid for any of this out of my pocket. It was all a grant through this association.